This is Dr. Corey Moss. We're doing these very tiny micrografts, which is a technique that we've developed along with the special way I do it, with these very small, these are 19 gauge needles and 20 gauge needles, really the same needles we use to do injections. And I'm making tiny little slits here in between his existing hairs, and that's enough for us to slip a hair graft in. And you can see from the little slits that I've created how much density I can do. I can probably get, on the average patient, up to 20 to 30 grafts per centimeter squared, which is pretty much a full frontal hairline. So I'm working that as I count these grafts, and I've got my technicians, which we'll show you in just a second, working in the other room, cutting them into natural follicular unit hair grafts. Hairs grow naturally in 1, 2, or 3 unit groups. So there's 1, 2, or 3 hairs in a follicular unit, and they're cutting them under magnification to exactly that specification, just like our hair grows naturally. And as I place these, which we'll show you a little bit later, the density of these grafts will be so high and the natural appearance of them that you won't even be able to tell the difference between the hairs that he started with and the hairs that I'm going to be transplanting in just a second. So I wanted to get a chance to show you a little bit about hair grafting. There's a lot of confusion about it. There's a lot of excitement about it with all the marketing going into the system that does punch grafting, which was really not at all new. We've been doing punch grafting for decades now. And so the big discussion now is between the stripped technique, which is where you harvest a strip from the posterior or the back part of the head, and then the technicians cut the strip. And the argument against that is it has a linear scar, but I'll tell you that I've done many of these. I've never had a person that had a scar that was even noticeable, so that's not really an issue when it's done well. If you're going to really grow super short hair, if you want it cropped like a crew cut, that's a good candidate for doing the punch grafting technique. There's a number of different companies that do it. NeoGraft is, of course, the most popular of them. Very nice system, easy to use, but the system itself is not as important as the design of the hairline, which I've worked out with this patient, and then, of course, the placement and direction of these grafts, which we do with great care. So if you have any questions on hair grafting, don't hesitate to write us at drmoss.com. You can visit our website at mossclinic.com. And as always, it's Dr. Corey Moss on Looking Your Best.